Welcome to this training module titled Requesting Restricted Access to the MedStar Health Network for Research Monitoring. Restricted access to electronic health records for sponsor monitoring protects patient privacy and complies with regulations like HIPAA. This procedure describes the process approved by MedStar Health to request non-employee access to the MedStar Health Network. In the context of monitoring clinical trials, non-employee roles are external personnel such as monitors, auditors, and inspectors. The scope of this procedure applies to all research activities administered at MedStar Health facilities and all affiliated and satellite locations, MedStar Georgetown University Hospital and Georgetown University Medical Center, all referred to as MedStar Georgetown, and all monitors, auditors, and inspectors who are in an official capacity to review health records of subjects who are enrolled in clinical studies. Throughout this presentation, key terms that will be used include HIPAA, which is the Health Insurance Portability and Accountability Act that protects the privacy and security of individuals' health information. The minimum necessary standard requires covered entities to evaluate their practices and enhance safeguards as needed to limit unnecessary or inappropriate access to and disclosure of protected health information. And protected health information, also known as PHI, is any health information linked to a specific individual and is created, received, maintained, or transmitted by a covered entity, and PHI is protected by HIPAA. MedStar Georgetown research personnel request access for a monitor, auditor, or inspector to access specific subject records within the electronic health record system for research purposes. This is a formal process to ensure proper authorization and adherence to privacy regulations. MedStar Health Research Institute receives all access requests and coordinates with MedStar Health IS. MedStar Health IS facilitates the process to set up and inactivate accounts for monitors, auditors, and inspectors as appropriate. MedStar Health Compliance will conduct compliance audits as needed, and the monitor, auditor, or inspector is responsible to view real-time source data verification of subject records that MedStar Georgetown research personnel has linked to the monitor, auditor, or inspector account. In the first part of this procedure review, we have introduced the purpose, scope, responsibilities, and some key information about the procedure. We are now going to transition into discussing the set of actions for research personnel to request access for those external monitors, auditors, or inspectors. Sponsors, entity, or agencies that are involved in a research project at MedStar Georgetown must be listed on the HIPAA authorization as parties to whom protected health information may be disclosed during the study. If the IRB waives the HIPAA authorization requirements, sponsors, entities, or agencies must be listed in the IRB waiver application to ensure a proper plan is in place to protect the privacy of protected health information. The sponsor, monitor, or auditor has a right and obligation to review source documents, including paper and electronic records, as referenced in the FDA drug and device regulations. As a covered entity, MedStar Health has a right and obligation to control access to paper and electronic records. When data is entered directly into an electronic health record, the electronic data in the system is the original source document. Restricted read-only access is granted to monitors, auditors, or inspectors to MedStar Health's electronic health record and research studies, where subjects have signed informed consent and HIPAA authorization. A printout or print screen of electronic data in the electronic health record is considered a shadow chart and should not be used as original source documentation. If a printout or screen print is used, the copies must be certified as identical to the original source. Let's review the general workflow for research coordinators and monitors to prepare network and electronic health record access for external personnel involved in clinical trials. First, The monitor will inform the research coordinator of an upcoming monitoring visit and will provide the list of subjects to be reviewed. Second, at least 1 week in advance of the scheduled monitoring visit, the research coordinator will initiate the process to ensure the monitor has access to the MedStar Health Network and patient chart queue in the electronic health record. Third, the research coordinator will provide the confidentiality and security agreement to the monitor for review and signature, and the research coordinator will sign as well. Once signed, the agreement is valid for 1 year from the date of signing and must be updated annually. Fourth, the research coordinator will complete the required fields in the REDCap form in order for the monitor to gain access to the network and the electronic health record. Once the form is completed, the research coordinator will upload both the fully executed agreement and the subject list provided by the monitor. Fifth, an executive sponsor will be notified of the signed agreement, retrieve the agreement from REDCap, and sign it. It is the policy of MedStar Health that an executive sponsor must review and sign the agreement to attest to a legitimate business need for third-party users to have access to the MedStar Health electronic health record. Sixth, information services will be notified of the subject list, and the list will be retrieved from REDCap, and a chart queue will be created in the electronic health record. The chart queue is explicitly limited to a maximum of 25 records. And seventh, the monitor now has visibility to the chart queue in the electronic health record, and visibility is limited to a maximum of 5 business days. Understanding the purpose of the confidentiality and security agreement for non-employees is essential for maintaining data security and compliance during external access. Administrative, technical, and physical safeguards. The monitor acknowledges that user ID and password, meaning their credentials, are unique and non-transferable, agrees to log off the system when not at the workstation, and understands that approved access may be audited. Acceptable uses and disclosures. The monitor agrees to access, use, or disclose information only in the performance of duties or permitted by law, and agrees not to copy, download, print, or transmit information in any format. Reporting requirements. If the monitor encounters patients who are not research subjects, the monitor is obligated to notify the research coordinator of the security incident and maintain the confidentiality of such information. Let's now review the 5 sections in REDCap to be completed by research personnel. Section 1. MedStar Georgetown individual requesting access for a research auditor monitor. Each request will have a return code. If you need to edit the form, the return code will give you immediate access to the form to edit. A record ID is given to each completed form. You must complete each section that states "must provide value." The name of the individual submitting the monitoring request is required. An email address, telephone number, and location is required. If MedStar Health IS needs any information to complete the access request, the contact information is available. Section 2, Non-Employee Sponsor Monitor Request. Research personnel completes this section to request new vendor or sponsor or identify if a vendor or sponsor is recurring. The required fields include the monitor first name, the monitor last name, if the monitor has previously had access to the electronic health record, the monitor username is not required, the monitor's email address, the monitor's telephone number, their title, and the start date of the monitoring visit. The stop date of monitoring is not required since the patient queue is inactivated after 5 business days. Section 3, Sponsor Company Registration Request. Research personnel will complete the section to request a new non-employee or identify if a non-employee is recurring. Before a new non-employee can be registered with MedStar Health, the vendor organization must be registered. Once a new non-employee profile has been submitted, the information takes approximately 4 hours to be replicated through the system. This must be completed before requesting network access. For the monitor to keep an active account, an extension must be completed every 90 days. Section 4, Network MedConnect ARIA Access Request. Research personnel will identify access to either MedConnect ARIA, which is specific to oncology, or both. The last section, titled MedConnect Research Patient Records Requested for Monitoring, Audit, Inspection. Upload Form 2, the patient list, which is limited to 25 subject records and electronic health record patient queue. Upload Form 1, the signed confidentiality and security agreement. Here is the patient list that is uploaded to REDCap, and a list is used by MedStar Health Information Services to create the patient queue for monitoring visits. The required fields include the protocol number and the protocol short title, the subject names limited to 25 subject records, the medical record number or financial identification number, which is the Envision account number. The visit date is the specific dates related to subject participation during the study period to verify data and protocol adherence. List the sponsor, monitor, or auditor that will be reviewing the subject records. And the dates the monitor, auditor, or inspector will be reviewing subject records, and the subject records are available in the patient queue for 5 business days. Let's do a quick knowledge check. How many weeks in advance should you prepare for a monitor to gain access to the MedStar Health Network and electronic health record? 1 week, 2 weeks, or 3 weeks? To prepare monitor access to the MedStar Health Network and to prepare the chart queue and electronic health record, preparations should start at least 1 week prior to the monitoring visit. Next, the chart queue created in electronic health record is limited to a maximum of how many subject records? 15, 25, or 35. By limiting the number of subject records to 25, this helps the monitor stay within the scheduled time frame for the visit by focusing on the necessary data. Next, once the confidentiality and security agreement to gain access to the electronic health record is fully executed, it needs to be updated every 6 months, annually, or every 3 years. Annual updates are necessary due to potential new technologies that are introduced, and annual reviews are a critical part of the compliance process. And last, the maximum number of business days the monitor has visibility to the 25 records in the chart queue: 5 days, 15 days, 25 days. The maximum number of 5 business days that the monitor has visibility to subject records helps minimize the risk of unauthorized disclosure of protected health information and ensures that access is strictly for the minimum necessary amount of time required for the authorized purpose. As stated throughout this procedure, we have discussed Form 1, the confidentiality and security acknowledgement for sponsor monitor access to MedStar Health electronic health record. Form 2 is the patient list for remote direct access to electronic health record. Each monitor is limited to 25 subject records in the electronic health record queue for review and monitoring. Attachment A of the procedure is a step-by-step process for the monitor, auditor, or inspector to register the Microsoft Authenticator application for non-employee access and provides 2-factor authentication to access the MedStar Health Network. Attachment B is an example of the subject record request list. And Attachment C gives directions regarding the patient chart queue in ARIA for oncology studies as applicable. In summary, this procedure outlines the process approved by MedStar Health for requesting non-employee access to the MedStar Health Network and electronic health record, ensuring clarity for staff and non-employees. The two forms associated with this procedure include the confidentiality and security agreement and the patient queue list. The general workflow includes scheduling a monitoring visit and providing a subject list for review. Ensure at least 1 week to prepare monitor access to the electronic health record. This workflow emphasizes the need for signatures from the monitor and research coordinator to confirm adherence to confidentiality and security. The research coordinator uploads to REDCap the confidentiality and security agreement and subject list provided by the sponsor. An executive sponsor from MedStar Health must sign the agreement to confirm access is required by the monitor to perform work duties. Information Services prepares the chart queue, and the monitor now has access to a maximum of 25 subject records with visibility in the chart queue for 5 business days. The key takeaways of this procedure are confidentiality and security. Takeaway 1 includes safeguards, where the requirement is to implement administrative, technical, and physical safeguards to protect information. Takeaway 2 includes acceptable uses and disclosure, giving guidelines to access and use information only in the performance of job duties. And takeaway 3 includes reporting requirements with the obligation to report suspected or actual security incidents immediately. This concludes the overview of the procedure titled Requesting Restricted Access to the MedStar Health Network for Research Monitoring. If you would like more information on this joint MedStar Georgetown procedure, please visit the Georgetown website shared on the screen or the MedStar Health Research Institute procedures available on Starport. If you have specific questions about this procedure, you should ask your manager for clarification or assistance. They can provide guidance, answer your questions, and help you understand the procedure more effectively. Thank you.